This conference is being recorded.
Thank you for being with us today. Today, I am accompanied by Dr. Tam and Dr. New, and my colleagues, Minister Haidu and Minister Anand. As of this week, over 50% of Canadians eligible have received their first dose of vaccine, and many others will receive their vaccine in the coming weeks.
More than 50% of eligible Canadians have received their first dose of vaccine, and many more will be getting their vaccine in the coming weeks. This is good news, and when it's your turn to get vaccinated, please do so. I would now like to turn to my colleague, the Health Minister, Patty Haidu. Patty?
Merci, Dominic, and good afternoon, everybody. As we end a week of appreciation for nurses, I first want to start by saying a profound thank you to everyone nursing across the country. I've had amazing conversations all week with nurses that are nursing in public health and primary care, doing research, supporting people all across this country. And I want to thank every single nurse for caring for our close ones and for the sacrifices that you're making every day, especially during this time of this extraordinary public health challenge. Like all Canadians, I look forward to the day where in my community of Thunder Bay, Ontario, we do get back to a normal life. But we all know we still have work to do to get there. So today, I'll share with Canadians that we have published a roadmap discussed with all the provinces and territories that will guide us as we ease our restrictions. Dr. Tam et Dr. New pourront en parler plus en détail.
Dr. Tam and Dr. New can elaborate shortly, but here's an overview of the indicators to follow before we loosen public health measures. Transmission of COVID-19 would be at a manageable level. The public healthcare system would be sufficient for testing, tracing, isolating, and quarantining a strong percentage of cases and people who have been in contact with infected people. There would be enough capacity in healthcare for outbreaks, and measures for risk reduction would be in place for vulnerable people and those who are at elevated risk.
Canadians are getting vaccinated. Provinces and territories can use these guidelines to inform how and when specific measures should be eased. And here's what that means for you. For now, you need to keep following public health advice, whether or not you've been vaccinated, to keep yourself, your family, and your community safe. More people need to be vaccinated before we can ease restrictions. And that's why I encourage you to reach out to help friends, family, neighbors, colleagues who might need help booking or getting to a vaccination appointment. For the summer, as Dr. Tam shared with Canadians, if 75% of us that are eligible for vaccines have one dose and 20% have had a second dose, we can start to see these restrictions be lifted based on public health situations in your area. You'll need to continue to follow the local public health advice and keep up with individual measures like physical distancing and wearing a mask indoors. But you can look forward to small outdoor gatherings with family and friends. And in the fall, if 75% of those eligible for vaccines have received a full COVID-19 vaccination series, then local public health could be able to lift even more measures. And we should be able to do more activities indoors with people outside of our household. We all have it in our power to increase our chances of having a safe summer, a better summer for everyone. So please continue to choose activities that present lower risks to you and to your family, and keep following public health advice to help your local public health unit get to a place where restrictions can be eased in your community. I want to thank every single Canadian who stepped up to get vaccinated when it's their turn. I too have joined you, and I am so proud of all of you who are taking that important step to save lives and stop the spread. Thank you. Merci.
Merci beaucoup, Patty. Alors, on va
Thank you very much, Patty. Now we will go to our colleague, Minister Anand.
Thank you so much, Dom, and good afternoon, everyone. Today, I will provide an update on vaccine deliveries into Canada and milestones that we have reached. As of yesterday, more than 20 million doses of COVID-19 vaccines have arrived into this country. Canada is currently in the top G20 countries across a number of metrics, including total doses administered per capita, percentage of population that has received at least one dose, and average daily vaccination rates. In particular, 42% of all Canadians have had at least one dose of vaccine, and more than half of all Canadians who are adults have received at least one dose. In terms of individual suppliers, Pfizer is delivering 2 million doses per week this month and will deliver 2.4 million doses each week in June, constituting 5 deliveries in June alone. 42% de tous les
42% of all Canadians have received at least one dose, and more than half of all Canadian adults have received at least one dose. Pfizer is delivering 2 million doses per week this month and will deliver 2.4 million more doses each week in June.
Due to the upcoming Victoria Day holiday, Pfizer has agreed to deliver doses earlier by moving up a significant portion of the deliveries scheduled for the week of May 24th. So, next week, Canada will receive a total of 3.4 million Pfizer doses, 2 million arriving as scheduled early in the week, and 1.4 million doses arriving on Thursday and Friday ahead of the holiday weekend. The balance of the scheduled doses for the week of May 24th, approximately 600,000, will arrive shortly after the holiday Monday. Combined with the upcoming delivery of 1.1 million Moderna doses next week, Canada will be receiving 4.5 million doses in total next week. To repeat, 4.5 million doses of Pfizer and Moderna are arriving to Canada next week. We are continuing negotiations with our suppliers to accelerate deliveries so that the provinces and territories can get vaccines into the arms of Canadians as rapidly as possible. Across the country, we are seeing provinces and territories expanding the groups eligible to book a vaccine. Le gouvernement continuera de travailler.
The government will continue to work around the clock until every Canadian who wants a vaccine has one.
Continue to work to bring millions of vaccines to this country for all Canadians. This is my goal and sole focus, and I will not relent as we all recognize the importance of having enough vaccines for all Canadians. Thank you. Merci. Miigwech.
thanks very much, Anita. We're now going to turn to Dr. Tam and then to Dr. New. Teresa.
Bonjour à toutes et à tous. On a national level, we're seeing hopeful signs that we've passed the peak of the third wave. The latest 7-day moving average of daily case counts is more than 20% lower than the peak in April, dropping to less than 7,000 cases daily for the first time since early April. We're also beginning to see reductions in the number of people experiencing severe and critical illness. with less than 4,000 people with COVID-19 being treated in our hospitals each day, including less than 1,400 in intensive care, and an average of 48 deaths being reported daily. This is important progress, but the numbers are still too high. We must drive infection rates down much lower while getting our vaccine rates as high as possible. To date, over 17 million COVID-19 vaccine doses have been administered across Canada. This is great news and improving every day. But we can't let go of the public health measures and individual precautions that are our essential safety ropes to prevent another resurgence on this tricky path. As our modeling shows, by maintaining control measures until at least 75% of eligible adults have received a first dose of a COVID-19 vaccine and at least 20% of them have had their second dose, we would drive infection rates low enough and raise vaccine protection high enough to allow for lifting of restrictions without overwhelming health systems. But one dose of a two-dose vaccine series is not enough to maximize protection. We need to aim for at least 75% of everyone who is eligible for vaccination getting fully vaccinated. And we can't go halfway. So it is very important to get that second dose. The good news is that our first target is within sight. 4 weeks ago, less than 25% of adults had received at least one dose of COVID-19 vaccine, and now we're at just over 50%. This month, with significant increases in vaccine supply, ramping up of vaccination programs, and Canadians coming forward, as well as encouraging others, we're making great strides and can look forward to enjoying an outdoor summer that gets us back into many of the activities we've been missing. In very general terms, this means we'll be able to get back to small outdoor gatherings with family and friends, camping, outdoor sports, small reunions at picnics, parks, and patios will begin to bring us together in person again. We will still have to follow local public health advice and keep up with individual measures, like physical distancing and wearing a mask as recommended. Heading into the fall, as more and more Canadians get fully vaccinated, giving us broader protection across our communities, we'll be able to look forward to moving indoors together. This would mean getting back to indoor work, in-person learning at colleges and universities, and recreational activities, as well as finally being able to get back to the in-person multi-household celebrations and holidays we've been longing for. To get to this better summer and fall, we need to keep doing everything we can to protect ourselves and our communities, ease the pressure on the health system, and help bring an end to this pandemic. This includes rolling up your sleeves to get vaccinated as soon as you are able. Thank you.
Bonjour à toutes et à tous. À l'échelle nationale,
Hello, everyone. On a national level, we're seeing hopeful signs that we've passed the peak of the third wave. The latest 7-day moving average of daily case counts is more than 20% lower than the peak in April, dropping to fewer than 7,000 cases daily for the first time since early April. We are also beginning to see reductions in the number of people experiencing severe and critical illness, with fewer than 4,000 people with COVID-19 being treated in our hospitals each day, including fewer than 1,400 in intensive care, and an average of 48 deaths being reported daily. This is important progress, but the numbers are still too high. We must drive infection rates down much lower while getting our vaccination rates as high as possible. To date, over 17 million COVID-19 vaccine doses have been administered across Canada. This is great news and improving every day. But we can't let go of the public health measures and individual precautions that are our essential safety ropes to prevent another resurgence on this tricky path. As our modeling shows, by maintaining control measures until at least 75% of eligible adults have received a first dose of a COVID-19 vaccine, and at least 20% of these have had their second dose, we would drive infection rates low enough and raise vaccine protection high enough to allow for lifting of restrictions without overwhelming health systems. But one dose of a two-dose vaccine series is not enough to maximize protection. We need to aim for at least 75% of everyone who is eligible for vaccination getting fully vaccinated. And we can't go halfway, so it is very important to get that second dose. The good news is that our first target is within sight. 4 weeks ago, fewer than 25% of adults had received at least one dose of a COVID-19 vaccine, and now we're at almost 50%. This month, with significant increases in vaccine supply, ramping up of vaccination programs, and Canadians coming forward, as well as encouraging others, we are making great strides and can look forward to enjoying an outdoor summer that gets us back into many of the activities we've been missing. In very general terms, this means we will be able to get back to small outdoor gatherings with family and friends. Camping, outdoor sports, and small reunions at picnics, parks, and patios will begin to bring us together in person again. We will still have to follow local public health advice and keep up with individual measures like physical distancing and wearing a mask as recommended. Heading into the fall, as more and more Canadians get fully vaccinated, giving us broader protection across our communities, we will be able to look forward to moving indoors together. This would mean getting back to indoor work, in-person learning at colleges and universities, and recreational activities, as well as finally being able to get back to the in-person multi-household celebrations and holidays we've longed for. To get to this better summer and fall, we need to keep doing everything we can to protect ourselves and our communities, ease the pressure on the system. The video has frozen.
It looks like Dr. New has gone off the.
Alors, peut-être on va commencer avec les questions maintenant. Nous allons maintenant prendre des questions.
We will now move to questions. We have about 30 minutes.
And we have about 30 minutes. Do one question, one follow-up. I'll pass it over to the operator to take the first question. Je vais maintenant passer la parole à l'opérateur pour la première question.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Our first question, la première question. Marie Vastel, Le Devoir, your line is open. À vous la parole.
Oui, bonjour. En fait, ma question est pour vous.
My question is for you, Mr. Leblanc, on another topic, if I may. Yesterday, the government of Quebec tabled its reform of Bill 101. As you surely know, the government announced that they will be amending the Constitution to say that Quebec is a nation and that French is the only official language. Is the federal government does it agree that a province can modify the Constitution unilaterally? What does Ottawa think of possible amendments? Answer. Marie, thank you for the question. I became aware of that proposal yesterday, like everyone else. Over the weekend, I hope to speak to my colleague, Minister Lebel, Sonia Lebel of Quebec. I haven't had that opportunity yet. The government hasn't yet received guidance from Mr. Lemetzi, the Justice Minister, or Minister Joly, the Official Languages Minister. so I don't have any comments on that today. In the coming days, we'll have something more substantial to say.
Est-ce que vous avez commandé?
Question. Have you asked for legal advice from the Department of Justice or others? And without talking about, the sound quality does not allow for the interpretation of this question.
Et mener d'autres provinces ou des groupes autochtones à vouloir emboîter le pas à Québec et faire leur propre demande constitutionnelle?
Answer. As you know, our government, the minister responsible, Minister Joly, but the government has published a white book, a document detailing improvements, modernizations of the Federal Official Languages Act. It's a document that I found perfectly appropriate in Acadie and in other regions of the country. It was pretty well received, and that's the focus for our government. We're looking at bills that would follow, of course, that would follow the document published by Minister Joly a couple of months ago. So that's the focus for our government. And in the coming days and weeks, my colleagues may have something to say about the Government of Quebec's proposals, but personally, I haven't yet had the opportunity to really be briefed on these questions. And I won't make any specific comments. I haven't yet had those discussions with my colleagues.
Prochaine question.
Thank you. Merci. La prochaine question. Mia Rabson, the Canadian Press. Votre ligne est ouverte. Please go ahead.
Yeah, hi. My first question is for Dr. Tam. I'm wondering if you could talk a little bit about this return to more normal life and these markers, 75% and 25%. What happens if we don't meet them, and why are they so much higher than what we've seen in other countries? The UK, for example, about half have one dose and about a quarter have both doses. And next week, they're widely opening up much more than you suggest we will be, even at 75 and 25. So I'm just wondering why we're setting the bar so high and what happens if we don't meet those bars.
Yeah, so these are modeling projections about what could happen, and with lots of different parameters, assumptions to fill in. But I think having an aspirational target is really a good thing for everyone to aim for. En route to that target, provinces and territories will have to take into account their epidemiologic picture primarily. The UK, if you sort of look back at their epidemic trajectory, they crashed that curve, that very massive third wave, to very low levels by the time they got to that kind of vaccine coverage. You need to look at both of those parameters. At this point in time, provinces might be reaching some of these vaccine coverage levels that the UK was seeing when they were lifting, but the epidemiologic picture is completely different. We're still just beginning to peak on this third wave in many different provinces and territories. So what we've done is we've also published some indicators on top of those vaccine targets, because you have to actually let the epidemiology and the data drive the slow reopening measures at the local level. So some of these indicators on top of these targets of vaccine coverage includes looking at your transmission indicators. So if your transmission is controlled in terms of COVID-19, that includes forecasts and reproduction numbers. That includes sufficient testing, tracing, isolation capacity so that you can detect resurgences and do something about them. It includes looking at hospital and other health care capacities before you can safely reopen slowly, staged, and in a sort of thoughtful manner. And so your vaccines will help, will be a major help in helping keep your rates low and point towards a future that includes some of these activities that we've longed for without resurgences happening. And by the way, there's the estimates that we provided, like 75% first dose, 20% second dose, is modeled upon the kind of rates you should aim for if you don't want your resurgences to overwhelm your hospital systems again. That's what that number is for. And so I don't know if that answers your question, but it really is a combination of indicators that people should be looking at, but really important for Canadians to have something to look forward to. And these are aspirational targets.
Mia, follow-up?
Yeah, thank you. My next question, I'm not sure who wants to answer this one, but we received 655,000 doses of AstraZeneca from COVAX yesterday. For now, they're sitting in freezers. There are countries all over the world who would maybe desperately want these vaccines and would use them today. Why did we accept these doses if we're not going to make sure that they're going to get into arms and not sit in freezers?
Maybe I can start. It's Patty. How do you? Well, I think the premise of the question is a little bit askew because, in fact, there's no indication yet that provinces won't be using AstraZeneca for second doses. And so we're working with them right now to determine their allocations and what provinces and territories will need to complete vaccinations for those people that have had the first dose of AstraZeneca. Obviously, we're monitoring this very closely, and my expectation is that doses of vaccine, regardless of the variety and type, don't go to waste. Perhaps, Dr. Tam, you want to add a little bit more about that?
Yes, so at the moment, in discussion with Chief Medical Officers of Health, broadly all across the country, they've halted any further administration of that first dose, and that any existing supply will go towards provision of the second dose for those who've had one dose already. Based on what I know is just over 2 million doses have been provided as the first dose. So I think this 655,000 would potentially go towards individuals who wish to have the AstraZeneca vaccine as a second dose. But you have a very good point, and I think we are waiting for the studies, including one certainly from the United Kingdom, to determine whether we can provide an mRNA vaccine as that second dose. And I think early indicators show that is a good option, but we're waiting for that data and for NACI to provide that recommendation. At that point in time, I think obviously there may be less people who would take up the AstraZeneca vaccine as a second dose, but is it important to still have that option right now? And of course, we need to evaluate the use, thoughtful and ethical use of the vaccines that we have in our country, and we shouldn't take any further doses that we can't use.
Okay, we'll take the next question, please.
Thank you. Merci. Our next question. La prochaine question, Raymond Filion, TVA. Your line is open. À vous la parole.
Merci, bonjour.
Question. Hello. I'd like to know how many active cases of the Indian variant are there currently in Quebec and in Ontario? People who live in these provinces or people who are being treated?
Merci.
Answer. Thank you for the question. Dr. New here. I'm connected again. I apologize for my technical problems earlier. Along with all of the provinces and territories, we continue to keep watch for variants of concern, but to date, personally, I don't have the exact numbers for the number of people who have the variants. I think it's something that's always changing. To me, it's not a question of how many cases of variant. We know that the variants can be more transmissible. It's an indicator of what's happening at the local level with community transmission. Whether it's a variant or not, the same principles apply for public health measures and individual precautions. So people need to continue to respect those measures. But perhaps later we can provide the exact numbers based on the evidence that we receive from the provinces and territories. I don't know if Dr. Tam has anything to add. Thank you.
Okay, sorry, go ahead.
Oui, concernant le variant.
Answer, yes, concerning the variant B1167, I believe. We have a few systems for sequencing the variants now. We've discussed with provincial and territorial labs to detect this variant. I can say that it's been detected in sampling from travelers at the border. So from international travelers. We'll have numbers soon regarding that variant.
Have, now that this variant has been reclassified to a variant of concern, and we know that there have been some cases, because we're sequencing 100% of cases of the samples coming across for travelers. So we should have that data available but we'll have to get back to you on that one. And we know that there have been cases detected in provinces and territories, and there may be some early signs that we already have some community transmission. But as Dr. New has said, this variant shows increased transmissibility, a bit like the B117. We have not seen any data pertaining to the other attributes. It doesn't seem to impact our PCR diagnostics. It remains to be seen in terms of any impacts on vaccines and treatments. Some early antibody data shows that it may be, again, like the B117, there may be some diminished antibody response, but to the class covered by the vaccine, but the vaccines will provide protection. So, the similar measures will be taken to manage the transmission of this variant as we have for other variants.
Sweetie Ray?
So as a follow-up, So as a follow-up, Dr. Tam, and perhaps Minister Haidu, if you have any information, feel free to jump in. Is there anyone with the B1617 variant from outside Ontario and Quebec who is currently getting medical care in those two provinces, to your knowledge?
I'm not aware. We don't have data as to the individuals, patients that are being treated, but I do know that B1617 has been detected in more than those two provinces.
Okay, next question.
Thank you. Merci. Our next question, Kevin Gallagher, CTV National News. Your line is open. À vous la parole.
Hello. Thank you for taking my question. I'm interested to know. So this summer, providing things go well with the 75-20% ratios, we could go camping, hiking, have picnics, patios, and outdoor gatherings. But I'm interested to know what's the difference between this one-dose summer and the no doses that we had last year, because it seems like all of those activities were things that people were being encouraged to do safely last summer. So I'd like to know sort of what's the benefit, what's the encouragement for people to go out and get vaccinated when it seems like the restrictions are pretty much the same as what we had when we had no vaccines last summer.
Can someone hear me?
Yes.
My video feed has just disappeared.
Oh,
I can
no,
hear you.
Teresa, we can see you, Teresa. Go ahead.
Okay. So I think individuals who got the vaccine should feel more confident, even with one dose, that they themselves have been better protected. That's the key about that one dose. But you've got to get that second dose to provide maximal protection. We do know that there's increasing data to show that these vaccines can reduce transmission, the mRNA vaccines, for example. So that is a good sign. But the majority of the population only have one dose of vaccine on board. And I think, so in general, you're essentially behaving like you haven't as yet got vaccinated. You're only halfway. So that's the general message is, to all intents and purposes, it may seem like last summer, you're going out on your patio, you're going outdoors. That's a really good thing. You should feel that you've got another extra layer of protection. What I would say is that it was very likely that throughout last summer, there were transmission and hidden chains of transmission that has occurred that would lead to a resurgence in the fall. In this summer, one would hope that with all on board, with the ongoing case detections, and we got to keep doing surveillance and trying to detect cases all throughout the summer in order to avoid any resurgence in the fall. So what's the difference is between this summer and the previous one is that we stand a much better chance to having an outdoor summer that doesn't lead to a resurgence in an indoors fall. So that's a more of a population health way of looking at things. But as an individual, you should feel much more confident if you've got any doses of vaccines on board that you yourself are better protected.
Dr. New, maybe I can just add a couple of points to what Dr. Tam said. I think maybe the two aspects which are maybe different this summer compared to last summer is that in many parts of the country we're still battling the third wave, right? And so the case counts are high. The healthcare systems in certain parts of the country are still sort of close to the breaking point. So that's why we certainly have to be very careful. And of course, as just I think with the previous question, there's also the issue of circulating variants, right? Many of them have shown to be more transmissible. So in some ways, there's a less of a margin for error in terms of individual practices and how you may be able to protect yourself. So that's why I think even if we have optimism and hope that the vaccines are going to lead us out of this pandemic, we can't let up on the public health measures, and that's why we're optimistic and we want people to get vaccinated as soon as possible, recognizing that these two other factors are in play as well compared to last summer. Thank you.
Kevin, go ahead with your follow-up.
Right. Yesterday we saw from the U.S. Sorry, I'm just getting a little feedback there. That they released, mask guidelines. That when Americans that are fully vaccinated don't have to wear masks, no social distancing. So when will that type of advice be issued to fully vaccinated Canadians?
So I think from a public health community perspective and in discussion with chief medical officers, I think masks might be the last layer of that multi-layer protection that would advise for people to remove. I think we have to slowly and surely ease the more restrictive measures, those shutdowns and stay-at-home orders. Those are the really key things that we need to really avoid as a community, as a population, and not have a resurgence as soon as you release that. That is the primary objective moving towards the fall. If we get into the sort of, we might get 2 doses into arms quicker than the fall, but it's moving into the fall is when you go indoors. And we have to be very careful when we're going indoors. Even with 75% coverage, 25% of people may not be covered. So you actually have to be really careful as you slowly ease those measures. I think the data will direct us as to what to do and when that key moment is. The other thing, and Ms. Haidu would probably want to comment on this, is that as individuals, of course, we're all different in different circumstances, with different ages, with different underlying medical conditions, and the ability to control our environment. So I think another thing that we're hoping to do is given further guidance to people in terms of risk reduction for their individual assessments. And there is no doubt that even if you are immunocompromised, or you're someone who may not be able to mount an immune response, for example, you're going to continue to take a number of measures, including wearing of masks might be, again, as your last layer of measure to be taken off. So we are taking a bit of a different approach to the United States, and maybe a little bit more similar to that of the United Kingdom.
Est-ce qu'on peut répéter la réponse en français, s'il vous plaît?
Alors, je pense comme... Oh, ben, allez-y, Howard.
Answer to be repeated in French now. Go ahead. It's Dr. New now. To summarize what Dr. Tam has already said, I answered this question as well. Here in Canada, we have more of a collective community approach. It's not so much an individual question, but what's happening in the community. We may be vaccinated, but others may have a weakened immune system, and so it's important to continue to wear a mask, even if we've received 1 or 2 doses of vaccine. So in Canada, our infographics show the way forward. That's not only a question for an individual, but what is the vaccine coverage in the community? What's happening at the epidemiological level? So we need to look at the indicators and look at what's happening in the community, in the hospitals, for the healthcare system, with vaccine coverage. So it's not as simple as comparing ourselves to the United States and saying, what can we do? Can we stop wearing masks with 1 or 2 doses of vaccine? Thank you.
Please.
Thank you. Merci. Our next question. La prochaine question, Laurence Martin, Radio-Canada. Votre ligne est ouverte. Your line is open.
Oui, bonjour.
Question. Hello. For your goal that 75% of Canadians having received a first dose, 20% having received a second dose, when do you think it's realistic that we'll hit those marks? With the vaccine rollout you're seeing now, with deliveries arriving, end of June, early July, end of July, could you give us a more concrete date, please?
So Dr. New.
Answer, Dr. New. Now, I can say that with what's happening currently with deliveries of vaccine doses to the provinces and territories, I think we're well positioned to offer all eligible Canadians a vaccine by the end of June, so the beginning of summer. I think that's the first step, to offer a dose of vaccine to all eligible Canadians. And for the second dose, it depends. Each province and territories have their own vaccine rollout. It's a priority to offer that second dose to priority groups like seniors and at-risk people, those who are vulnerable to dying of COVID-19. And then we'll be extending it to other priority groups. So for the second dose, we hope we can offer a second dose to all Canadians and have that vaccine coverage of 75% at the end of September, the beginning of the fall.
Si vous me permettez.
Minister Leblanc, if I may, we are very confident in the province's capacity to deliver vaccine doses. For a number of weeks, we've seen the provinces increase capacity to deliver vaccines to groups that have been chosen and then the general public. As Dr. New indicated well, and as the Prime Minister and Minister Anand have been saying for a number of weeks, we are confident that before the end of June, all Canadians who want a first vaccine dose will have it. We hope it'll be 75%, if not higher. And we know which priority groups there are, like healthcare professionals who've sometimes had a second dose, and provinces will be sending these second doses to these priority groups. But over the summer, with a significant increase in vaccines arriving in Canada, as Minister Anand indicated, we are very confident that second doses will be administered over the summer and perhaps in September, as Dr. New said. So we are very confident that we're on track, as we've described for a number of weeks.
Suivi, Laurence?
Follow-up question, Laurence.
I'll let Minister Anand come in.
Well, and if perhaps Minister Anand can say, my question was about the 20, and that's not my second question, but my question was really about like that 20% of second dose, when it's realistic to get that, so that we can go through this really first step that you guys mentioned earlier today.
Well,
So,
So
Mrs.
from a
Teresa, maybe I
procurement
can be more precise. I know that provinces and territories are already going back to administer the second doses. So long-term care facility, for example, I've been told that the majority of them are already getting their second doses. And then, of course, the healthcare workers and Indigenous communities that were the initial cohorts. And so that's already happening. And why 20%? Well, 20% is a calculation on some of those highest risk groups. And by having them already getting their 2 doses, then you stand to lift those measures without overwhelming your ICUs and some of your hospital systems. While we're talking about the second dose, it is very important to get the second dose. But I just want to reassure people, because we have had a lot of questions about that interval, that dose interval. And you may have seen one of the studies coming out of the United Kingdom, which shows that even for seniors, these are over 80-year-olds, who got the Pfizer vaccine, mounted a much stronger antibody response, 3.5 times stronger, when the interval was stretched and the second dose was delayed to 12 weeks compared to the 3 weeks. So I think for the people who are anxiously waiting for their second dose, I think that Canada and in following, I think all the provinces following the advice of the National Advisory Committee on Immunization, I think did a very smart strategy.
Minister Anand?
I would like to just underscore that this discussion is possible because of the increasing supply that is continuing to come into this country. Next week alone, Pfizer will be advancing another 1.4 million from the week after to accommodate the long weekend, in addition to the originally scheduled 2 million doses. So combined with the 1.1 million doses of Moderna that we expect to receive next week, also, we are going to see 4.5 million doses coming into this country next week alone, which is unprecedented in terms of our vaccine deliveries. It's as a result of our diverse portfolio of vaccines and the increasing ramp up in the millions of doses coming into this country that we can have this conversation about the supply and what that means for all Canadians. And for the federal government's part, we will continue to bring in millions and millions of doses into this country to support the provinces and territories in their inoculation efforts. Thank you.
Doctor, maybe I could just add.
Sorry to interrupt. I just wanted to re-emphasize what Dr. Tam said, because I think it's so important. Canada pursued a 2-dose strategy that had a delay between the first and second dose. And we know that there's been a lot of commentary about that. And, many Canadians wondering what that meant for their health outcomes. And I think it's really important to reiterate that the science is finding that that delay is actually helping people mount even stronger immune response. And so, this is what was the underpinning of NACI's recommendation, both to save lives and based on, data and historical knowledge of how vaccination works, that in fact, by delaying that second dose, that it would not impair people's ability to mount an immune response. And in fact, what the research is showing that is that it creates even a stronger response because of that extended delay. I think that is good news for Canadians who have been very patient and who have contributed so much across the country to making sure that everyone can get that first dose in their community. And I think it's another opportunity to say thank you to the Canadians that have come along with us on this approach that, yes, does differ than our American cousins, but is much similar to the UK approach. And so perhaps, Dominic, you might want to repeat some of that in French.
Est-ce que je peux juste poser ma question de suivi, juste pour qu'on...
May I ask my follow-up question? Go ahead, Laurence. Yes, it would be for you, Minister Leblanc. Regarding opening up again, I know it's the provinces that ultimately decide when they open up again and how. We saw after the second wave, provinces that opened up pretty quickly led us into a third wave in Quebec and Ontario. Do you fear that this time, once again, the provinces will open up too quickly? Thank you, Laurence. I can give a few comments, and then Dr. New or someone else is welcome to add to them. To take up what Patty Haidu said as well, I think it's important to say in French as well that the Canadian strategy to give a first dose to the greatest number of people possible, that's what the provinces decided to do. And this will probably lead to better immunity in the long term for the people who've received this type of vaccine schedule with the second dose delayed. Minister Haidu spoke about some studies that can confirm that this strategy may lead to good, if not better, protection. So we're confident about that. Regarding reopening, you're right. Maybe after the second wave, some public health measures were taken away at a speed that, with the arrival of variants, of course, allowed for a third wave to take root. It's clear that currently, with the increase in the number of people who are vaccinated and public health measures as set out by the provinces and local authorities, will mean, we hope, that we can avoid a wave as difficult as the third wave we currently have. But the Prime Minister and Dr. Tam, Dr. New have said clearly that it's important to keep public health measures in place long enough to really allow for the curve to go down and to allow for vaccinations to go up. And that's the work we are doing in partnership with the provinces. The discussion between ministers from the federal government, our provincial and territorial counterparts, and public health leaders like Dr. Tam and Dr. New allow us to look for a national approach to give Canadians the same message in terms of what we can do this summer, what we will be able to do this fall, and especially tell people about the opportunity to have a safe, measured, reliable economic recovery and reopening. So that's the work we're doing with the provinces and territories. And we will continue to work closely to ensure we do this in a coordinated, coherent fashion.
Merci. C'est Dr. New.
Thank you, Dr. New here. I'd like to highlight another point from Minister Haidu, and it's really to recognize the good work by our National Advisory Consultation Group on Immunization. They've really looked at the evidence. They've recognized the principles of immunology and vaccination, and that's why they've made their recommendation to stretch the interval between the two doses. So now we see with what's happened with clinical trials and results, what's happened in the United Kingdom. And as Dr. Tam said, we've compared the immune response in terms of antibodies for people who've received a second dose after 3 weeks or 12 weeks. And the antibody level, the immune system, is 3 times stronger for those who received the second dose 12 weeks later compared to those who received it 3 weeks later. So it's very important to continue to follow the science and analyze what's happening with the evidence. Thank you.
One last question on the phone. Nous allons prendre la dernière question. Merci.
Thank you. Merci. Our last question, la dernière question. Stephanie Levitz, Toronto Star. Your line is open. À vous la parole.
Hi, thank you. I'm going to go back to a question that my colleague Kevin asked about what is and isn't on these guidelines released today. I mean, is this the best we could do? Is this the best we can give people hope and encouragement about why they should get just even a single dose of a vaccine, never mind 2?
Maybe I can start and then turn to the doctors. Well, first of all, thank you for the question. And I think the short answer is the best reason that someone should get vaccinated is to save their own life, to protect themselves from COVID-19, and to stop the spread to their family and their community. That is the best reason to get vaccinated. It will save your life. It will stop the spread in your community. It will protect your family. It will protect your colleagues. But of course, we wanted to also give people an indication of what increasing vaccination in the country and in communities would look like, and what kind of activities we could anticipate would be returning to our everyday lives as a result of increasing vaccination. And of course, we are a federation, which means that provinces and territories have dramatically different healthcare systems. They have different epidemiology. COVID is, in some cases, even right now, significantly surging in some regions. In other regions, there is very little COVID. So it is hard to have a national guidance that gets at the specific nature of COVID-19 in particular regions. But this is a roadmap for Canadians. This gives Canadians a vision of what it looks like as we proceed down this vaccination path together, what kinds of activities we can anticipate we can enjoy without worrying about either catching COVID or transmitting COVID. And certainly, I think it helps provide that guideline for Canadians as they undergo their own communities' journey with vaccination. So I think for me, this is an important step forward. It does provide a unified vision for the country, but allows for that local public epidemiology, how much COVID is in a community, how much vaccination has occurred within a community, and those variables are important. And that's why the companion piece online really gives Canadians an indication of those kinds of metrics that they can follow along for a more specific understanding of their own region's risk factors. Dr. Tam?
Yes, so these are obviously very broad targets and guidance. And we would look towards providing more specific guidance for individual settings or situations like we have all along, but now with the vaccine on board. So I think that's a different kind of communication. But I think for the general public, I think the key is that vaccines play a really important part when you only have mostly one dose on board, keep going with all these protective measures, but the outside is great. You can get outside and do lots of things safely. With a view, in the not too distant future, by the way, especially if we can get the second dose covered fast, is that we can then get safely back indoors and do some of the really key things that we've missed doing without a rebound. So I hope, of course, that's only one way of encouraging the public to get vaccinated and still hang on for those public health measures, given that we're not yet down the curve. We've got lots of other ways of communications, as well as, I think, different innovations in providing fundings to local jurisdictions or organizations to get people vaccinated, incentivizing people to get vaccinated in different ways. I think lots more carrots will be good. And just so that I can end by giving a shout out to Peel, Peel region is doing an all night long vaccination clinic, and they're going to have fun things that will keep people be drawn there. But if you got shift work, for example, an all night clinic sounds just the thing that would be quite attractive. So lots and lots of different activities will have to take place to get Canadians to that kind of target. But these general overarching targets, I think, are helpful.
Stephanie, follow up?
Yeah, just as a follow-up, just because lots of folks are also pointing to this idea of a one-dose summer, two-dose fall, and saying, well, if vaccines are coming online at the rate they're supposed to, ought it not be a one-dose spring and a two-dose summer, and then we're actually back to normal by fall? And I wonder what your assessment is of that. Is that fair for people to think, or are we still too far off from moving up that timeline in a meaningful way?
It's Patty again. I would say that if that is possible, of course, that's the ideal state. And we are working, and I know my colleague, Minister Anand, is working day and night to get vaccines into the country earlier and faster. So this is a target based on our current projections. Of course, it could shift to be an earlier target where we see more people more rapidly vaccinated with a second dose. And if that's a possibility, of course, provinces and territories are eager to pursue that approach as well. But I will say that we remain focused on this as a realistic target, and we will adjust our projections if the situation changes. Anita, would you like to add a few words?
Sure, Patty. I will just mention that work of procurement that Patty just described to accelerate doses to earlier and earlier time periods in this year is exactly what we do at PSPC every day. And as a result of our negotiations that are ongoing with suppliers, we've already accelerated 28 million doses from later quarters to earlier quarters this year. So we will continue to pull in unprecedented numbers of vaccines into this country. As I mentioned, 4.5 million doses alone next week. And we will have, by the end of May, in total, 25 million doses of vaccines brought into this country alone. And so, yes, the vaccine procurements and deliveries are continuing to accelerate. But as my colleague, Minister Haidu, mentioned, we want to be realistic. And if it turns out that we can adjust, we certainly will do so, but it's important to be realistic in terms of what we are bringing in and what Canadians can expect as a result. Thank you.
Est-ce qu'on peut répéter les réponses en français, s'il vous plaît?
Oui, bien sûr.
Repeat it in French now. Yes, go ahead, Anita. No, go ahead, Dominic. Go ahead, Anita. Okay. As I've already said in English, every day, every week, my department and I are working to accelerate the delivery of doses. We've already accelerated over 28 million doses to have doses in the current months and earlier. So over the next week, we will have 4.5 million doses next week. And for the month of May, over 25 million doses will have been delivered to Canada. So that's a realistic approach. And we need to think of our supply every day. But it's important to be realistic as well.
Ça a mis la fin à la conférence de presse. That's the end of the press conference. Have a great weekend, everyone.